Kirsten Adnum. I'm the Nurse Manager for the Kids Cancer Centre at the Sydney Children's Hospital. I've been in this role for the past 3.5 years, but I've actually been working in oncology here at Sydney Children's Hospital since 1999, and I started as a registered nurse on the inpatient ward C2 West, and I've also done other positions. I've been the clinical nurse educator, the nurse educator, the nurse unit manager on C2 North, as well as a clinical nurse consultant for 5 years. When I was young, about 13 or 14, my next door neighbour was diagnosed with a childhood cancer. He was one of my closest friends and he had treatment for about 4 years. However, he passed away. So I think just my experience growing up with somebody that had a paediatric cancer made me passionate about wanting to, I guess, contribute. Spending time with the nursing staff on the ward and encouraging and supporting the nursing staff and watching them grow over time, and we get new nurses, new graduate nurses that start on the ward and they haven't worked anywhere else before, and they become passionate about paediatric oncology as well, and it's really lovely to see their growth over the years and them get more confident over the years and for them to progress into other positions as well. So I really enjoy, I guess, nurturing those more junior nursing staff on the floors. I think that there's a couple of things. I think that childhood cancer isn't really thought of as much as adult cancers, and a lot of the adult cancers get a lot of research, a lot of donated money, so it's really good to sort of create an awareness in the general public that there are children that do have cancer, that they do become unwell, and some children actually don't survive. I also think it's a time, a month, where people can reflect who have been touched by childhood cancer, whether they were the patient themselves, whether it was a family member, or whether it was the nursing and medical allied health staff that was looking after the children that we do look after. And it's just a time to reflect on the journey and what involvement that we had in that journey. And I guess for me as well, it's just nice for me to remember all the children that I've come in contact with over the last 17 years, and remembering all of those children is important for me as well.